So we have lactated ringers and normal saline of resuscitative crystalloid. What would then be other resuscitative fluid or things I can give you? Just think simple. Someone's bleeding to death, I'm going to give you blood. So blood is a resuscitative fluid as well. What are the different types of blood products that we have? What's the best one, in my opinion? We have it in the trauma bay. Nope. Nope.
Whole blood.
Nope. Whole blood. So we're lucky enough here to have whole blood. When you're bleeding, you're not bleeding salt water. I always say that. You're not bleeding normal saline. You're not bleeding packed red blood cells. You're not bleeding FFP. You're not bleeding platelets. You're bleeding whole blood. So we love to give initially whole blood. Then we have the other components. Now, when you give somebody an MTP, what's that stand for? Massive transfusion protocol. When you call for an MTP, what does the blood bank bring us? Well, that's how you want to do it. Good. So you want to transfuse in a 1:1:1 ratio. But what's actually delivered to us? What is the 1:1:1? We've already talked about it.
Usually 4 packed red cells, 4
Yeah, so we have packed cells, FFP, and platelets. The platelets typically come in a pack. And a pack of platelets is like it's 6 units, right? So like we give 6 of packed cells, 6 of FFP, and a pack of platelets. That keeps us in that 1:1:1. What would be a good thing that we can order to see how the blood's functioning in clotting? Okay, coagulation studies. So PT, PTT, INR, good. And then we go along with that, we have a PFA, platelet function assay. But what do we have that's even better? Yeah, so there's ROTEM and there's TEG. We just transitioned to TEG. So now we have TEG, thromboelastography, literally gives you a graph of how the blood is clotting and tells you what you need to give based on that graph. So it's as directed as possible to the coagulation cascade. It's a beautiful thing, right? So that is our goal, again, giving resuscitative fluid. And then the other side of this is maintenance fluid. So say I have a bowel obstruction, I have an NG tube in, and I've been NPO for 3 days, and the NG tube's putting out quite a bit. What type of fluid do I want to give that patient? Yeah, that's a good answer. You want to always look at your electrolytes. That's why we get every day a BMP with a MAG and a FOS on patients, especially with NG tube decompression, bowel obstruction. But what's the quintessential, if you will, maintenance fluid that I always harp on?
D5.
Yeah, so D5, half normal saline with 20 milliequivalents of potassium chloride. That's like your classic maintenance fluid. And then how do I calculate how much to give?